Welcome to the Quick Start Guide for Medline's automatic digital wrist blood pressure monitor, model MDS3003. This unit ships with a blood pressure monitor pre-connected to the wrist cuff that fits wrist circumferences ranging from 14 to 19.5 centimeters. It includes an operation guide, a quick start guide, and 2 AAA alkaline batteries. On the front of the unit are systolic, diastolic, and pulse rate measurements, along with the memory and start-stop buttons. On the back is the compartment for 2 AAA alkaline batteries. Let's begin by setting the date and time. If using the device for the first time, insert the batteries according to the polarity diagram found on the inside of the battery compartment. Once the batteries are inserted, close the battery compartment door. With the unit off, press and hold the memory and power buttons for about 2 seconds. You'll hear a faint chime and the month will begin to flash. To toggle between months, press the memory button until the appropriate month is selected. Then, press the power button to change the day. Press the memory button to toggle between days. When the correct day is selected, press the power button to set the time. Please note that this unit only displays military time. Press the memory button until the appropriate hour is selected. Then press the power button to change the minutes. Press the memory button to toggle between minutes. To increase the speed at which the minute is selected, hold the memory button for about 2 seconds. Press the power button when you're finished. The date and time are now set, and the unit will continuously display the date and time even when the unit is powered off. Now let's look at cuff placement. The monitor should be positioned along the inside of your wrist, on the same side as your palm. It's very important that the cuff is sized properly, otherwise you can get an inaccurate measurement. The cuff should fit snugly but comfortably about 1 to 1.5 centimeters below your wrist. The blue and white triangle on the inside of the cuff should be arranged with a sizing arrow on the outside of the cuff. Here we can see that the triangle falls within the proper range. When you are about to take a blood pressure measurement, please make sure you're seated and your elbow is placed on a flat surface with the palm facing up. Place the white plastic armrest below your forearm to help keep your arm steady. The monitor should be at heart level, also facing up. Make a loose fist to prevent your fingers from moving. Your feet should be flat on the ground. Some helpful tips about blood pressure. Genetics, age, sex, altitude, physical activity, stress, certain medications, or even the time of day can all influence blood pressure. Avoid continuous readings. Wait a minimum of 1 to 1.5 minutes between readings to allow blood flow in the arm to return to normal. At least 15 minutes between blood pressure measurements is ideal. Home blood pressure measurements may vary as much as 10 to 20 points from those taken at your doctor's office. Now let's use this unit to take a blood pressure measurement. The cuff is applied to either wrist and the power button is pressed to begin the measurement. The cuff inflates until it gets to above what it expects the systolic pressure to be, and then it starts decreasing. When the measurement is complete, you'll see the measurements flash on 2 screens. The first screen shows the systolic pressure at the top and the diastolic at the bottom. The second screen shows the pulse rate with the letter P. On the left is a color indicator that correlates to your results. When taking a measurement, you can stop the inflation of the monitor at any time by pressing the start button. This unit can store up to 60 past readings. When more than 60 readings are stored, the oldest ones will automatically be replaced. By pressing the memory button, you can see any of the past readings. The letter M indicates you are in the memory bank, and the corresponding number lets you know which reading you are looking at. The first measurement is your most recent reading. Keep pressing the memory button to cycle through the older readings.